Hello, everyone, and welcome. Today we have a very exciting program, and we're glad that you're able to join us. My name is Dr. Stephen Itzkowitz. I'm the chair of the American Cancer Society National Colorectal Cancer Roundtable. And this webinar is really to introduce you to a new resource. Many of you are aware that there are a lot of really wonderful resources that the National Colon Cancer Roundtable has developed over the years. Today, we're going to share an exciting resource that's really first of its kind that allows you to explore data using maps and graphs to illustrate colorectal cancer statistics alongside a variety of other variables, as you'll see in just a few minutes. This dashboard was actually launched just last month at the Southeastern Colorectal Cancer Consortium Conference. So we're really delighted to share this with you today. And you'll see during the presentations that you can find data related to colon cancer surveillance, screening rates, various healthcare settings, demographics, and additional healthcare measures. Next slide, please. So the purpose of today's webinar is to understand the potential for using this GIS data science tool for colorectal cancer prevention and control. We all know that our work is driven by data, and so you'll see how powerful this tool can be. You'll also hear an example of how mapping tools can be used to tailor interventions to increase colon cancer screening in local areas where you work, and also to learn how to use the colon cancer dashboard to interactively explore data using maps and graphs. And of course, we'll have a Q&A session towards the end. There will be time for questions, and please insert your questions in the Q&A box throughout the program as you think of them. I'd like to just acknowledge before we get started that the dashboard was compiled by the Geospatial Solutions Team, the digital solutions at the American Cancer Society in March of 2024. The ACS National Colon Cancer Roundtable would also like to thank members of the Geospatial Solutions Team, led by Dr. Liora Sahar, who generously dedicated their time and expertise to the development of this resource. So today we'll have two presentations, one by Rebecca Dabbs and the other by Liora Sahar, and I'm sure that you'll have a lot of interest in what they have to say, and we'll learn a lot. But before we get started, we wanted to take a poll to share, for everyone to share their experience using GIS data science tools. So in this poll, we're asking you to please answer, one, I do not have experience using GIS data science tools. Two, I have used GIS data science tools before, but not on a regular basis. Three, I use GIS data science tools regularly, at least once per month. Or four, I am a GIS data science tool super user at least once a week. So if you can you please just enter your answer to the poll so we get some sense of who's in the audience and who's logging on today. Looks like we're almost there, but from the results of the poll, it looks like we only have a handful of super users, and probably almost half of you have no experience with the GIS data science tool, which is great because now you're going to learn about it. Some of you have used it, but not on a regular basis. So we really hope that by the end of this hour, you'll have a sense of how powerful this tool can be and how to go about using it. Next slide, please. So now it's my pleasure to introduce our first speaker. The title of Rebecca's talk is Data-Driven Approaches to Colorectal Cancer Screening, a San Diego case study. So Rebecca Dabbs will be presenting this. Rebecca is Associate Director of Community Partnerships, and I'll let her speak to you at this point, and then she'll turn it over to Liora after she's done. Thank you so much, Rebecca.
Thank you so much, Steve. Yes, my name is Rebecca Dabbs, and I am the Associate Director of Community Partnerships in Southern California in the Patient Support and Community Impact pillar. My role engages with and supports primary care clinics, federally qualified health centers, community clinics, coalitions, and collaboratives in the Southern California area to increase cancer screening rates and cancer prevention. I do this through working with our partners through a variety of ways, and some of them are listed here. You could go to the next slide. So last year, I was invited to lead the strategic development and execution of a colorectal cancer screening project in partnership with our San Diego CEOs Against Cancer. The American Cancer Society's CEOs Against Cancer, it's an initiative that unites top executives from diverse industries to fight cancer. With 18 chapters nationwide, the CEOs Against Cancer has over 300 chief executives who are actively involved in the fight against cancer and represent more than 45 industries. The San Diego chapter is one of 5 elite chapters known as the CEOs Against Cancer Executive Circle. And last year, they fundraised for and launched a project focused on increasing colorectal cancer screening rates in their area. Yeah. Next slide. Thank you. The project was aimed to engage primary care clinic and community clinics in a year-long colorectal cancer screening initiative to increase screening rates for underserved communities in the San Diego area. The project had 4 main goals: to identify and collaborate with a healthcare partner on the project, to launch the screening initiative by implementing it at the partner's healthcare site, to address barriers by supporting the partner clinic to identify and overcome both patient and provider barriers to colorectal cancer screening using evidence-based interventions, best practices, and technical support to boost screening rates, and also to increase public awareness within the health system and local community about the importance of screening for eligible populations. And understanding the demographics of the San Diego area was really crucial when developing the screening project, because we knew it would help us tailor our approach to meeting the specific needs of the population served. San Diego is a diverse community, but different communities within San Diego may face unique barriers to screening, such as cultural differences, language barriers, and varying levels of literacy and access to healthcare. So by learning about these demographics, we can implement more effective targeted interventions. And I had worked with our ACS GIS data science team in the past on other projects, and it helped me recognize the value of these tools and what they can bring to my work. Next slide. So we use the geospatial data tools to help us guide and support our project. The dashboard is invaluable because it compiles a range of data sets, a comprehensive view of community characteristics, and we used it to identify key demographics in the San Diego area. Allowed us to pinpoint populations and tracts in San Diego County that are most at risk and in need of colorectal cancer screening, and understand the demographics better to target our efforts and identify the ideal clinic to work with and partner with. It also helped us recognize and consider the diversity of the community, which was essential for our efforts to succeed. The data on race and language help us to appreciate the cultural and logistic diversity of our target population. Next slide. So as you can see, the map shows us a high-level overview of San Diego County, and it provides us with a lot of valuable information. San Diego County is home to over 3 million people, which is a dynamic population, and it was important for us to not see a homogeneous group. To effectively address colorectal screening, we needed to zoom in on the communities within the county, and this required more granular data to gain deeper understanding of the unique characteristics of these populations. Using these tools, we were able to get detailed census tract data, allowing us to analyze various demographic factors at a much finer scale. This data included information on race and language, education levels, poverty rates, and social vulnerability indices, which we'll be able to see in the next maps. You could go to the next slide. So this image shows us the poverty status broken down by census tract in San Diego County, with the darker areas representing higher concentration of population below poverty levels. And the pins represent the location of federally qualified health systems. Understanding the poverty status of San Diego County and where those FQHCs are located was really key in identifying which health partners to work with on this project. As you can see, there are several pockets scattered throughout the county where more than 24% of residents reported income below the poverty level compared to the national average of 13%. With limited fundings available for this project, it was really important we're working in the areas with the greatest need and ensuring that we're helping to increase screening among the targeted underserved population. You could go to the next slide. So in these images, you can see the race on top right and language bottom left with demographics. And again, with FQHC locations identified. In San Diego County, we identified substantial Hispanic and Latino communities spread throughout the county, further emphasizing the need for cultural and logistically appropriate communication. Additionally, there were several large pockets where 34% of the population speaks Spanish at home, and that's significantly higher than the national average of 13%. So understanding the prevalent language spoken within our community is crucial for the success of our initiatives. By recognizing that a significant portion of them speak Spanish, we're able to tailor our communication material to meet their needs. Providing information in the language and the native languages of our target population, it ensures that our messages about colorectal cancer screening are not only understood, but actually resonate with the community. Next slide. This image shows the education attainment, with the darker areas representing a higher percentage of the population with less than high school education. So the data revealed significant educational disparities within San Diego County. Specifically, there are large pockets or tracts where 21% of the population reported that the highest education level they completed was less than the high school. So that is almost double the national average of 11%. So understanding these educational disparities was important for our outreach and education efforts. It allowed us to develop and disseminate messages that are not only in the language of the community, but also crafted at the appropriate health literacy level. By ensuring that our outreach material were designed to match the literacy levels of the target population, we can make our messages more accessible and impactful. Next slide. And understanding also the social vulnerability of a community is crucial for designing and implementing effective cancer screening projects. And social vulnerability encompasses a variety of factors related to a community's capacity to prevent, prepare for, respond to, and recover from adverse health events. It can also contribute significantly to health disparities. And although this map shows social vulnerability index tracks, it's important to note that San Diego County as a whole ranks 0.56 on the social vulnerability index, indicating moderate to high vulnerability. This data underlines the necessity of our project. It supports our partnership with an FQHC and primary care clinic and highlights the urgent need for resources to help increase cancer screening across the county. Next slide. So our efforts are more likely to succeed when we recognize and consider the diversity of the community we're trying to reach through its demographic data. The geospatial data has been instrumental in enabling us to achieve this by helping us to identify the patient population in primary care clinics areas of highest need. We formed a strategic partnership with primary care clinic located in these high need areas to maximize our outreach and impact and develop targeted interventions to meet the needs of the population. The data helped us use language that is accessible and meaningful to the target population. We incorporated culturally appropriate messaging in our communications to resonate more deeply with the diverse population in hopes of fostering trust and engagement. We made sure educational materials and reminders were available in languages spoken within the community to ensure that language is not another barrier to understanding the importance of colorectal cancer screening. The data also helped us tailor our intervention and communication efforts. We created localized campaigns that address the unique needs and specifics, the concerns of specific neighborhoods, making our interventions more relevant and impactful. And lastly, it helped us identify structural barriers that can be addressed to better serve the different populations. Geospatial data helped us identify barriers such as poverty and access to healthcare facilities that might hinder screening. We developed targeted intervention recommendations to overcome these barriers, such as offering free colorectal cancer kits and setting up outreach efforts in those underserved areas outside of the clinic. Next slide. I want to conclude my presentation with this wonderful image of our team of incredible cancer advocates standing in front of the rolling colon, our big inflatable colon. And this picture really embodies the spirit of our collaborative effort and the impact we strive to make in the community. Our healthcare partner in this initiative is Neighborhood Healthcare, which is a federally qualified health system in several sites that has several throughout San Diego County. Leveraging the demographic data we uncovered, we launched a campaign during Colorectal Cancer Awareness Month in March. We also partnered with Feeding San Diego to host a public awareness event at a monthly food distribution. This collaboration between the ACS, Neighborhood Healthcare, and Feeding San Diego aimed to improve coordination of patient care beyond the healthcare sites. At the event, our team distributed over 300 residents through both walk-up and drive-through access. We provided colorectal cancer screening information to attendees and invited them to walk through the inflatable colon, which in our minds was very engaging and educational for them. Prior to the event, we identified eligible patients from Neighborhood Healthcare who participate in the food distribution. And these patients in attendance were given take-home colorectal cancer screenings, supporting our effort to increase awareness of the importance of colorectal cancer screening and creating a medical neighborhood that fosters comprehensive community-based care and reduces access to care barriers. This initiative underscores the power of collaboration and community engagement, demonstrating how geospatial data and demographic can drive our mission forward by informing our development strategies. Next slide. And yeah, that's it for me. Thank you so much for letting me share with you today. I also want to extend my gratitude to the American Cancer Society's GIS data science team, Liora, and team, and also the NCCRT for creating and providing access to the dashboard to all of our stakeholders. And with that, I'm going to turn it over to Liora herself to take the reins. Thank you.
Thank you so much, Rebecca. So first of all, can you see my screen? I just shared it. I wanted to make sure that it's actually shared. Can everyone?
Yes.
Okay. Fantastic. So first of all, I would like to acknowledge this fantastic collaboration with Rebecca and her team, which you saw several data sets and that were customized specifically for her use case in that project. But what we're going to do today is we're going to share with you what's available on the Colorectal Cancer Dashboard that is available to all of you. But before I'm going to do that, I would like to give a special thank you again to my fantastic Geospatial Solutions team, who is also on the call, to Lisa, Antonio, and Nathan. And I do want to acknowledge two wonderful team members of American Cancer Society, One of them is Dr. Bob Smith, who is a senior vice president. You're going to hear about him throughout my presentation. And of course, Emily Bell, who is the director of the National Colorectal Cancer Roundtable. So thank you. And before we're going to continue, there are about half of you that haven't worked with GIS systems. So before we're even going to continue, what is GIS? So GIS stands for Geographic Information System, Science, or Services, depending who you ask. Our team works across this entire spectrum from research that we then apply and translate into tools that we can share either internally with American Cancer Society team members or with the public. And of course, the systems is the technology. Services is you're going to see all the services, all the data that we are serving and consuming. So that's what the services are all about. And it's all about data. It's all about evidence-based decision-making. It's all about how GIS can support this research into action, and action in your state, action in your community. And we're going to talk about this word community and what does that mean geographically, right? And I love this wonderful pyramid that you see on the screen going from data information to knowledge. Wisdom was added just a few years ago. Wisdom is like the highest. Wish we could get there, but even if we get to knowledge, that is absolutely fantastic. So really, it's all about utilizing data. But we wanted to also share with you, as Steve mentioned at the beginning, the tool was launched just last month. How did we get here? So last year, presenting at the Southeast Colorectal Cancer Consortium meeting, in the annual meeting, we talked about GIS. We listened to the audience, to the needs of everyone. And we said, wouldn't that be wonderful? Which, following some of the work that we've done with the National Lung Cancer Roundtable, again, working with Bob Smith and Lauren Rosenthal from the National Lung Cancer Roundtable, where a similar tool was launched several years ago. And we said that is about time that we're going to do that for the National Colorectal Cancer Roundtable. So in December of last year, we presented a draft dashboard and showed how that can actually be used. And immediately we had several volunteers that we thank each and every one of you that we recruited for the beta testing, and we listened to the feedback and we applied the feedback. And following the beta testing, we worked towards the actual launch of that of the dashboard. And it was very exciting last month to present at the Southeast Colorectal Cancer Consortium again, and actually be able to launch that tool and talk about how that tool can be used. So this is how the tool looks like, and we're gonna go and actually take a look at that. And as I said, I'm going to mention Bob Smith. Bob Smith in a meeting here in Georgia last year said something very simple but very profound. It was know your state, and it applies to know your community, know your region, right? Whichever geography and area that you're working on. And GIS is just a fantastic system and tool to actually start knowing this area, the state, the challenges, what's the burden of the disease. In this case, we're talking about, colorectal cancer. What is the distribution of the health system, right? Where are the hospitals, where are the FQHCs, and help us start to tailor interventions and programs, just like the ones that Rebecca was talking about. So one of the first things that we do, as we said, we're data based, right? It's all about the data, and one of the best publications, and I will say here, thank you to Becky Siegel, who is a fellow team member of American Cancer Society, a researcher, and looking into the publication from our team that was the Colorectal Cancer Facts and Figures. And in that specific publication, of course, there is a wonderful summary about also the geographic, distribution and the different risk factors as identified by research within the American Cancer Society and other groups. So yes, there is wonderful state level data in cancer facts and figures. And then we wanted to bring it down. State level is for the most part, if we're talking about community, state level data is too broad of a geography, right? So we wanted to start to provide all of you with at least county level data when available. So you can see on the right, for example, here is incidence rates from NCI State Cancer Profile, NCI and NCBC, and you can see mortality rates at the bottom. And then there are wonderful data sets, and that's one thing that I want to say about this application, and it's true for other applications as well. The application is bringing together data sets from many different agencies and organizations from authoritative resources that we vet ahead of time. And you can see here, for example, data from CDC Places, fantastic group that is using small area estimates to provide us data, different risk factors and other data sets. As services that we're able to consume and bring to you on the same platform. So in this case, for example, we have colorectal cancer screening at the county level. I'm also going to show you small area estimates, crude, not age-adjusted, that are provided even at the census tract level. And then we went back to cancer facts and figures and looked at different risk factors and tried to identify such services that are available from resources that we can provide to you, even if they're not exactly the same definition, but still allowing you to look at those. So as a result, we were able to provide you with obesity, binge drinking, and current smoking. Smoking, we know, is a huge risk factor, not just for colorectal, for many other, cancers. And all of the different resources, and that's something that I'm gonna emphasize all the time. You can go and you can read about it. It's really important. The metadata for any GIS and really for any data set that you work with, the metadata, the source, how the data was calculated. Did they use Burfess? Did they use Burfess and use small area estimates, for example, to come up with estimates for different counties and different geographies? Learn about the data, understand the data, feel the data. That's going to help you with your project. So what can you do right now with the dashboard? You can look at 2 different maps at the same time. We found that from previous work that we've done with different applications to be very useful, to be able to look at 2 at the same time. You can look at graphs, you can select different states, you're able to add additional data even at the census tract level, and I'm going to show you how that is done, and also create those customized, just like you saw that Rebecca created, those really customized visualization. For my project, do I need to look at where are the Commission of Cancer hospitals, where are the NCI designated hospitals, where are the federally qualified health centers? Do we want to look at mortality? Do we want to add data about demographics, about age, right? Where is our age that is, at a higher risk, looking at race, ethnicity, poverty, education. Again, there is so much that we can include in one dashboard, in one tool. It's not all the data that, I'm sure that you're all going to have a lot of ideas, but one of the things that we're also going to do is that specific tool is going to be used to distribute and share with you also research outcomes from American Cancer and from other sources. But at that point in time, what we are doing is we are bringing together data sets from different agencies, from different organizations into one application to make it easy for all of you. So you will be able to start, know your state, know your community, right? Explore deep into those geography, ask yourself questions, and we're going to actually do that in a second. You start to look at, the data, and that will cause you to think, what's going on here? Do I need to look at other data sets? So all of that you will be able to do. Dive a little bit deeper. Sometimes you will have the data, for example, at the census tract level, and sometimes you may need to go and look at additional data sets and gaps and opportunities. Isn't that what it's all about? Looking at the data and starting to identify gaps and where we need to be, right? What are those focus areas? And everything is about the final action, right? The call for action. So here is, for example, screenshots from the actual tool. You can see on the left, for example, mortality rates. You can look at those 5 quantiles of that. You can look at incidence rates, and then you can start to identify, hey, here is an area where we have high mortality and high incidence. Let's look at screening, right? So you have screening here and incidence. So you can start looking at different data sets at the same time. So before we're going to, and I'm risking a live demo, which is always kind of a challenge, but we're going to do a live demo. We're going to get to that in a second. But I don't want to go back to my final slide. We're going to go to the demo in a second. But I wanted to say a couple of things. Although we already launched in June, we got feedback even during the Southeast Colorectal Cancer Consortium, listening to all the different speakers, identifying, how else we can support and help all of you that are working in colorectal cancer. So we're already going to have kind of a new version coming probably in the next month about where we will include additional data sets, and you can see them, at least some of them will be included, as well as other functions. You have here QR code. I don't recommend logging and looking using a mobile unit, but you will get the link from that. I'm guessing that someone from the team is going to put the actual link to the dashboard in the chat in a second. And the really important thing is feel free to contact our team, acsgis@cancer.org. So, Emily, Steve, I think that we're going to go to the poll question, which will determine what we're actually going to do.
Caitlin, if you wouldn't mind, please bring up the slide so that participants can see the full questions.
You want me to do that? Okay. There you go.
Thanks so much, Liora. So yeah, for poll number 2, there's some various levels of use for this tool, regional or national, state, or even at the city or metropolitan area level. So we're curious to hear, how you might use this tool. Of course, it may be more than one.
And we don't have a lot of time, so I will, and they're so close right now. I will try to sprinkle information about specific parts of the other use cases, just so you will be able to learn about some of the functionality. But it seems like the national regional is kind of winning, although the state has. Come on, state level people, if you're interested, vote now. Okay, as you're doing that, I'm gonna pull up the to get ready. Let me grab this one out of the way. Okay, so I think that we have a winner. Is that the regional and national?
The regional, national, New York, New Jersey, Connecticut, tri-state area example.
Okay. Okay, so let me close that. As I said, I promised to all the other ones, because it was a tight poll, right? I'm gonna sprinkle information and functionality from the other scenario. So first of all, just to get to know, and Emily, by 1:40, I need to, I think, break. So not a lot of time to do a use case. But you see that collapsible panel here. This is where those of you that have never worked with GIS.
Liora, please hit screen share again.
Oh, okay. Sorry about that.
No problem.
Thank you. I never stopped sharing, but I guess that you were able to stop me from sharing. It's okay.
Liora, you have until 1:45, so you have a little bit of time.
Okay, good. Thank you. So let me go back. This is how the dashboard looks like. This is the landing page of the dashboard. So a couple of things. Obviously, there are the maps here. You can see this collapsible panel. Really important one, this is where you can contact us with any question. More important is there is a tutorial video. It's gonna show you around and help you, kind of understand the functionality, the different components of the dashboard. So those of you, half of you that, are not that familiar with GIS, this will be a great place to start. And then, of course, providing all the different data sources. We are consuming data from wonderful, fantastic organizations that have done a lot of work in calculating a lot of data sets and providing those, to you. In some cases, we download data from websites such as the Commission of Cancer, hospital locations, but you have organizations such as HRSA, such as NCI, CDC, and data from the Census Bureau that is compiled by the Esri Demographics team. So all of that with the links for you to go and further explore. As I said, really important to understand the data, feel the data, right? When you're starting to do any kind of analysis. Now, first of all, with each and every map you see here at the top right, this one will expand your map. So if you click on it, you'll be able to see just one map. And sometimes when you're creating a presentation or you want kind of a deep look, then this will be extremely useful. You can then go back to the original extent. The maps are in sync. So when you move one map, the other one will move with you. And I'm not going to go way too much into the functionality. You will see that in the tutorial video, but those are the layers. So this is where you see the eyes here. The eyes is what you use to get things on and off, right, from your map. So very easy, just toggle on and off. So I'm going to remove the COC hospitals here for a second. I'm going to keep mortality here. And here you see the screening. Now, at any point, this is your legend. This is where you can go to actually see what those colors mean, right? And that is extremely important, okay? So, we're talking about the tri-state area around New York, so the New York, New Jersey, Connecticut. So one of the things that you can do, by the way, one thing that I do want to mention about the list here, you see you have mortality, you have incidence, and you have screening. Those are sorted by the rate, but we limited that to 400. The reason that we limited that is because if we're going to pull all 3,000 over 3,141 or now over 3,200 counties in the United States, it's really going to hurt performance. So for now, we made sure that all the states, and sometimes even when you select several states, you will have, all the counties for that specific state sorted on the right-hand side. So you will see only the top, 400. Now, when you want to do a selection of the states, so for example, if I'm going to do New York, New Jersey, and then I'm gonna add here, Connecticut. So, come on. Okay, I'm doing something very risky here with the live demo. So if something doesn't work, I'm kidding. Okay, the one thing I want to mention about the filtering, because in different systems, we filter data differently. What do I mean by that? What you saw just a second ago, you saw the 3 states kind of highlighted. What we did is like we cookie cut the previous maps that were nationwide to those specific states, okay? We did not recalculate the statistics, so all the data that you see is compared nationwide. It's not compared to the other counties in your state, okay? So you can see how you compare nationwide and not just, within your state. So you see mortality on the left, and going back to the actual questions, what we said is we're launching a regional initiative to look at programs to address social drivers of health and behavioral risk factors that are associated with colorectal cancer incidence and mortality. So the first thing that you probably want to do is to look at incidence and mortality. So if I am going to remove the screening and I'm going to add incidence here, you will be able to see now a map of incidence rate and you see mortality rates. Now, you see that there are a couple of counties here in upstate New York. You see this county here. Let's actually click on that, and that is really important. There is everything is interactive, including additional information that you can get for all of those different geographies. So in this case, this is Allegheny, New York, and here is a county that we may want to closely consider. Here is the county here. When you click on it, you're going to get additional information. And also South Jersey, right? There are a couple of other counties, but we're going to try and focus on some of those. At any point, for example, when you're working, and again, you can remove the NCI locations right now. And you can do a screenshot, take those and push them into, for example, a PowerPoint, and I'm going to show you that in a second. Okay, so now we look at mortality, we look at incidence, and now how about we look at, for example, smoking. So let me look at, let me put smoking here. So you see here CDC places, this is the source, and you see that this is toggled off. So if I'm going to do that, I'm going to remove the incident, and now I can go and actually look at smoking. Okay, so this is smoking age adjusted, and we can see the legend right here. So you can see in the same, those counties here, right? We have higher smoking prevalence. And if you click on that specific county, the data is coming to us from the CDC Places project. You see a lot of information about different risk factors and different behavioral variables that are associated. We highlighted here, we just grabbed those that you actually have on the screen as part of the project. So we are going to look at smoking, and you can see here kind of similar patterns, right? Around upstate New York, West New York, and somewhat a little bit higher within the state of New Jersey. Nationwide, not that much, but then another variables that we may want to look at, for example, is obesity. So you can go and you can look at obesity. Again, you see some similar patterns. Again, copy, paste, do a screenshot and put it in your PowerPoint, and then I'm going to show you how everything comes to life. And now let's look at for example, let me remove mortality from this screen, and let me look at educational attainment. So if you're going to look here at educational attainment, and now I'm going to remove this entire group, and I'm going to look at poverty. So we're going to cover the different variables that we may want to look at. Again, you see some similar patterns. So helping you focus on those specific areas, potential geographic areas, right? Looking at the distribution, the geographic distribution of both poverty, education, and smoking as a risk factor, obesity, and others. What I would like to show, because I have 1 more minute, is for some of those layers, such as poverty, and that is something that Rebecca showed you a second ago. When you scroll and zoom in, first of all, a lot of times it's very useful to actually see in front of you the name of the county. If you don't want it, you can remove it at any given moment just by clicking removing the county layer. That just provides you the borders and the name. But what's also nice about some of those layers is that they're scale dependent. You see that now I'm looking at the county, but if I'm zooming in a little bit more, you can start to see the sub-county variation that Rebecca showed you a second ago. So when we're talking about community, and if we were looking at the last scenario over there, that was the city and the metro area, this is where you can really drill down and see those patterns. So again, you see here higher poverty. In this case, we're talking about the percent of population that has the highest education as high school. You start to see some geographic patterns that actually emerge. And if I can share with you one last thing on the screen, because you can imagine that I prepared for today. And when you bring all of those different, when you start to make the case, so do the report, and I would like to show that to your leadership. This is where you can actually create those screenshots, bring all of those data sets together after you fully understand, after you look at, the data, and make the case, right? Have the data-driven decision-making, right? But I would like to say one thing. The dashboard is not going to give you everything, okay? The dashboard sometimes is a really good start, a really good beginning to understand your community, to understand the burden, and start thinking about potential, solutions, programs, interventions. We're going to open that to questions, but on top of everything, I want to emphasize again, each and every one of you has a friend within the GIS team at American Cancer Society. Use our email, send us emails, send us feedback. This is going to be dynamic. It's going to change. We're going to add, we're going to, change the functionality. But we want to hear from you, what works for you, what doesn't work for you, okay? And how you're using that. So I will stop here and open that to questions. Is that okay?
Yes, great. That's wonderful. Rebecca, Liora, thank you so much for these very exciting presentations. And we really do want to hear from you. One of the strengths of the roundtable is our sense of community amongst ourselves. So, as Liora said, this dashboard is going to continue to evolve, and a lot of that will happen from feedback from you. Mark your calendars for Thursday, August 15th. From 1 to 2 Eastern time. There'll be office hours to help new users use the mapping tools. And if you have any questions or comments about the dashboard, the link is here on the slide. I forgot to mention earlier, but as you probably would imagine, this entire presentation has been recorded, and the recording will become available in the next couple of days. Let's turn to some of the questions that have already been dropped into the Q&A. One of the questions was, is the data downloadable? The visual presentations are very compelling and they're very nice, but what about investigators who really want the raw data to work with? Is it downloadable?
So the issue with the downloadable is that, as we said, we're not here to reinvent the wheel. So if another organization such as NCI or CDC actually make their data available, we consume it from the source, right? So you're getting the latest and greatest from the source. And we have to follow what they make available to us. And not all the time the data is available for a download. But what you can do is, we're not hiding where we're getting it from, right? So you can always go to the actual link of the source and get, the original data for additional analysis. We will say that as we did with, for example, with the National Lung Cancer Roundtable, and what we're going to do for this one as well, if this is our data, it's a lot of time downloadable because we make it such that you can download it. So I'm sorry, but not everything is within our control.
Thank you. There was a question about the San Diego case study for Rebecca. Were you able to look at how the demographic variables differ between individuals screened and unscreened?
Yeah, thank you. No, we didn't analyze that specific data. Our primary focus was identifying the overall demographic characteristics and needs of the community, but maybe that's 2.0.
I'd love to see that data, by the way. Yeah, sorry.
And actually, a question that I was thinking of as we were going through it, is there data on insurance status? I mean, we have a lot of granular data on, smoking, obesity, education, poverty. Is there information on insurance status?
So yes, and I will put a caveat to that, because like with a lot of other data sets, that data has a lag, right? So you only get it. So for example, even from the Census Bureau, there is data about insurance with many different variables. For example, who has private insurance, who is on Medicare, Medicaid, and whatnot. The one caveat is because there is a time issue between the time that the survey and the actual time when we can make the data available to all of you. With the way that health insurance is, the landscape is changing, I feel, on a daily basis. You just need to be extremely careful using that data, but we do have that data. So for example, Steve, if this is something that is extremely important for you, and you don't have a way of getting that, and it will be extremely useful to add that, tell us. If enough of you are going to say, hey, this is something that we really need, then not just consider, but we will, add that.
Thank you so much. And another question, I think, for Rebecca. Who funded the colon cancer kits, and how were they distributed? How was follow-up conducted for those who took home the kits?
So that is actually funded through the primary care clinic that we worked with. They had another grant for take-home kits. And so they wanted to merge the two projects together, and follow-up was within the clinic. They did the follow-up on that.
Okay. Here's an interesting question. What was something that you were surprised to learn using the GIS data, and did you alter or add any goals to your projects because of that unexpected information? I guess that's really for Rebecca. But Liora, answer too if you have any thoughts.
I'll let Rebecca go first. Go ahead.
Yeah, go ahead, Rebecca. Did you learn anything that surprised you?
Well, one thing that was surprising as the project kind of developed was that even though a lot of community clinics and the partners that we were working with had a lot of clinic sites, that access to healthcare was still an issue. And so that's why we did the outreach and partnerships with the food distribution to kind of go to the community and meet them there.
So I would like to mention one thing about the way that, decision making is being done. So everything that we're showing you here is really visual, right? You are making decisions based on, the maps. Those of you that don't have access to GIS, those of you that, are not familiar with GIS, we do many of those projects where we get people such as Rebecca or other people coming to us with, where should we launch, that program? Where should we we had a billboard campaign with X amount of money. Where should they be, right? Social media campaigns to increase awareness. Where should that be? And then that's where you start putting all of those data sets together and create spatial models and bring the power of GIS. The maps are fantastic, but the power is in all the data, the databases behind it, and the way that we cut and dice and do the statistical analysis and the modeling and all the rest of it. So the visualization is so a lot of times the first step in bringing a lot of data together in a really sophisticated way to answer a lot of those questions. But this is such an important step. Get to know the data, get to know your community, and then you will be able to start the deep dive into your communities and actually be able to be effective with your decisions. So I kind of not really answer that, but I hope that was useful.
To me, what's perhaps most impressive is that this is a very dynamic tool. A lot of the resources that we've developed at the roundtable are based on a lot of market research and deep interviews in the community. And we've developed a lot of resources, which I would actually draw to everyone's attention on our website. But this is a very dynamic tool. And that's what I think makes it impressive, which gets to the next question is, can you tell us what tool you're using? Tableau, QGIS? Is that a
So-
trade secret?
So first of all, our team is very vendor agnostic, so we use everything that you talked about. But the GIS community is so fantastic, and by the way, there are a lot of open source applications that you can use, such as QGIS. I'm really impressed with that question. So such as QGIS that is free, you know, and you can just go and do a lot of analysis. For the development of that specific one, we used Esri, ESRI, which is, and we use their server and what they call the ArcGIS Online to be able to publish all of that to you. But we use many, many other tools, you know, and the important thing, by the way, I think about any technology is don't abuse it. Use it, push it, but don't abuse it. So, you know, we're really trying to follow that. So for some of the statistical analysis, you know, and other stuff, we're using other tools. But for this specific one, we used Esri. And if I may say, Esri's demographics team, fantastic. Many of the layers that you see on that dashboard as well is data that they curate from the Census Bureau, bring it in, do the right processing, match it to the geography, and push it to us with so many different variables. So again, credit to so many organizations, but really the important thing is to bring all of that to you in one specific location. And we're gonna start pushing data that is specifically from American Cancer Society, I hope by the end of the year, but I'm not committing to anything.
Another question, and that is, you know, how often will this tool be updated with new data?
So what's really amazing about some of those, you've seen the data is coming from many different organizations. And as we say, we're using services. What's really nice about those services, and I will, for example, talk about Esri again, is that they are updating. For example, I believe that the demographics team is updating 4 times a year. Again, not committing to that, but last time I looked at that, it was 4 times a year. Their data is being, you know, updated. Other organizations are updating, you know, annually. I can tell you that we are, and some of the data sets we are updating. So the data that you will see is, I want to say, as updated as can be from those organizations, again, that are updating. And that's really important. Go to the source, right? So if NCI is providing us, you know, the data, then they're responsible for their data and they're doing a fantastic, you know, work updating their data. When we download the data, we do it at least annually. So at least once a year, the data is going to be updated and we pay attention to what's happening. So, but if you see something that is outdated, tell us. There are emails. We will fix that.
Great. Next question is, if there's both a color and diagonal lines, either suppressed or no data for the colon cancer incidence rate in the legend, does this mean that the data are unreliable?
So what we did in the, well, not necessarily. Some data, it says that it's either suppressed or there is no data. So it either means that the count was so low that NCI did not publish the data. And we know that for confidentiality reasons. Or another reason is that there is no data. If you go, for example, to State Cancer Profile, which is where you can create static maps of incidence and mortality, you will see that there are several states for incidents where we don't have any data. I don't want to speak for each and every state and say why the data is not available, but it just means that we don't have the data. But when you see that an entire state is not there, I think enough said.
Yeah, I think we're running out of time, and there's still a few more questions, and we'll see if we can try to answer those questions offline. You know, I think this webinar was particularly helpful, and it really highlights our motto, which is 80% in every community. And we really want to get 80% of people screened in every community. This is one way of getting to know every community. So again, we want to hear from you. Please communicate with us. Visit our office hours, August 15th. As you use the tool, let us know how it plays with you so that we can build it and improve upon it. I want to thank both Liora and Rebecca and the whole GIS staff and of course, the ACS National Colon Cancer Roundtable staff that worked very hard behind the scenes. Thank you all for joining us, and keep an eye out for the recording of this important webinar. Thanks again for joining us.
Thank you.